Cos'è l'allenamento immunitario? Come si può utilizzare nella prevenzione delle infezioni respiratorie ricorrenti dell'età pediatrica? Lo abbiamo chiesto a una vera esperta, la professoressa Erika von Mutius, professore di pediatria e di allergologia all'Università di Monaco di Baviera, che abbiamo incontrato qui a Milano al Congresso Europeo di Malattie Respiratorie, l'ERS.
Professor von Mutius, you have focused the attention of your speech on one drug in particular. The name is OM85. Which is the composition of this drug?
OM85 is a bacterial lysate, means it has 21 strains, which they crash, so to speak, by a chemical process, and which is a soup, so to speak, of small components of these bacteria. This is mostly what OM85 is.
And it mimics what happens in nature, the farm effect that you have explained in your lecture, is correct?
So what is known from these bacterial lysates is that it stimulates the immune system. And in particular, it stimulates the innate immune system. From our farm studies, we know that stimulation of the immune system is important for prevention. In the farm, there are slightly different bacteria than what farmer uses, but it seems at the moment as if the effect at the end is the same.
You've spoken about a sort of immune training, is correct? How it works, this immune training?
So the current concept now is that children who are at risk of developing asthma or wheezing with viral respiratory infections have an innate immune system which is not mature, which has not been trained sufficiently. And therefore this application of these bacterial lysates may help to train the immune system enough to become mature so that it can fight infections better.
And it delivers, it works?
There are studies now showing that these things work. There has been a meta-analysis on the most important studies and the most robust studies. We see that there are still some limitations because some of the studies were with low numbers of participants, but the company now is already running 3 very large trials. One is in Europe, which is called BEAR. Another one is EAGLE in the US, and that aims really at treating these children and see what the outcomes in terms of respiratory infections and associated symptoms there are, such as wheezing. There is another very large trial in the US which looks at this lysate as primary prevention. Children who do not have symptoms, but as primary prevention for subsequent asthma, and it's called OPEX.
And at the moment, which could be the place in therapy of OM85? Which could be the patient that most will benefit from the drug?
I can see that the children who benefit most are young children, because this is the phase in which the training of the immune system takes place, and they will manifest with a lot of respiratory infections and wheezing episodes, and these are certainly the children where you need to help the immune system.
So the training works?
We hope. I very much hope it works. I mean, these first studies are very encouraging. All of them showed effects. But as I said, there are some limitations, and therefore we need these large studies to hopefully really definitively know that it works and how it works.